This is Health Wealth Safe. We believe everyone is entitled to high-quality, inexpensive healthcare. What started as one doctor's dream to bring the control of healthcare back into the patient's hand has now turned into a partnership of independent physicians across the country, all working hard every single day to make this dream a reality for their patients. Together, we will unlock a healthier world. That's the power of Health Wealth Safe.
How are you today?
I'm good.
It's so good to see you, and it's such a pleasure. You're doing so wonderfully. I am Dr. MJ Collier, host, producer, and on-air personality for the Your Health is Important radio broadcast. I'm also in private medical practice in Lithia Springs, Georgia. The name of my practice is Atlanta West Primary Care. I was introduced to the concept of my remote checkup by Dr. Agrawal, whose practice is in Athens, Georgia. The concept had been presented to me multiple times, but no one had done it as eloquently as Dr. Agrawal did. That inspired me to partner with him and to start and initiate this into my practice. Now, I know we signed you up for the My Remote Checkup program, and they have really been good in monitoring certain disease states. So what do you think about that program?
I really like it. It provides a lot of information for me and it helps me to keep up with my numbers. So it's really good.
My Remote Checkup has been an absolute godsend. This allows them to feel we are actively involved in their care continuously, and we are. And it also just gives them a sense of home and camaraderie with the practice. I think my practice probably has about 5,000 to 6,000 patients in it. And being in constant contact with that many people is beyond my capability. But in partnering with My Remote Checkup has been a great concept and a great follow-through, so to speak. It's really done well for the patients. And as you can see, one of the things that has changed since we have been on that program, the numbers are markedly improved. I mean, we are really doing phenomenally well. And I think that program, because it's reaching out and touching you on a regular basis and keeping you actively involved in your healthcare process. So to have a good outcome, you have to have the right patient and the right provider, and you have to form a partnership. And I think that our partnership, along with the remote patient monitoring program, really is going to be the thing that's helped changing your healthcare. I've been doing on-air radio for 30 plus years. So that gave me an opportunity to meet a lot of people, and that's what you see on what I call my wall of fame. In that, I've had an opportunity to meet politicians, social activists. I've met a lot of entertainers, and that is just a continuation of the pictures that I have in my home. Patients love those pictures, and it sparks a lot of conversation. And patients say, how did you go? Where did you meet? And where were you when you were with Denzel Washington? Or where were you when you were doing the boxing? When patients feel as if you're actively involved in their care, they feel as if they know you. They feel as if you are part of the family, so to speak. They respond better. They listen to you. They do most of the things you ask them to do. And they live longer and healthier lives. So My Remote Checkup has allowed us to reach out and touch far beyond our capabilities, as if I was personally on the phone all day, every day. I am Dr. MJ Collier. The practice is Atlanta West Primary Care Associates. Reach me on all social media platforms at Ask Dr. MJ, and listen to me as a medical consultant on the Ricky Smiley Morning Show.
The U.S. healthcare system is facing a lot of challenges, especially when it comes to medical waste. There are almost 14 million Americans with 3 or more chronic conditions that require frequent medical attention. As this population continues to grow, how can we best support these individuals in a dignified and cost-effective way? Introducing Health Wealth Safe, a proven healthcare technology company focused on reducing cost while increasing the quality of care for everyone. At Health Wealth Safe, we use our FDA-approved devices through bidirectional communication with our care managers and physicians. Our devices work remotely to passively monitor your activities of daily living. With the Health Wealth Safe app, you are able to keep track of activities such as sleeping, water intake, medication, and so much more. We promote patient health and can also detect early changes in health, such as physiological and non-physiological data, which results in early management of the illness and prevent hospitalization. When a significant change in behaviors is detected, an alert will be generated to our team of highly qualified care managers. The care management team will then reach out to you, and if needed, we will refer patients to their own physician. This also cuts down on medical waste that is created with testing or imaging that you may have already had in the past. Health Wealth Safe wants to help change the way the medical industry works by providing timely, affordable treatment where you can actually see the results. This will lead to a lower overall cost of healthcare and more satisfied patients. Our app not only helps you keep track of activities and medication, but you can also store all of your medical records in one place. We believe that you should be in control of who gets to see your information. If you decide to simply share your information with a loved one or a caregiver, they just have to download the Health Wealth Safe app. You asked for a better way to do healthcare, and we heard you. Let's do healthcare the way it should be done.
I'm Dr. Bantwal Baliga. I'm an endocrinologist. My office is called the East Alabama Endocrinology PC. We have a website also. And I have another office in Columbus, Georgia. Then I have satellite offices in LaGrange, Georgia, and Athens, Georgia. We use all these technologies to do what is called the remote patient monitoring. For example, we have partnered with Dr. Subodh Agrawal. He has a program called Health Wealth Safe. It's an app on the phone. And this is a very good tool for me to keep an eye on a lot of my patients, what we call as a population health control. It is not enough to see patient one time in the office or see them once in 3 or 4 months, because things can go horribly wrong in between. So the idea is to remotely monitor these patients' blood sugars when they are at home, and the data gets sent to us over the internet, and we have an access. We have point people who keep an eye on all these patients, and I get notification if there are issues. For example, somebody having repeated hypoglycemic episode, somebody is having blood sugars of 400 and 500 all the time. So Health Wealth Safe is one of the best ways for me to do this population control and keep an eye on all my problematic patients who need more assistance. Now this will help our patients not to go to the ER, because we are trying to save money for Medicare and other insurance companies. Because if a severe hypoglycemia happens and if the patient has to go to the emergency room, that means about $10,000 to the insurance companies. So that's why the remote patient monitoring comes into play. I'm very happy because I have a huge population of patients, and as a single physician, I'm unable to keep an eye on them all the time. That's why when Dr. Subodh Agrawal approached me with this health save, it was a welcome idea for me. It was an easy adoption. Dr. Agrawal has assembled a great team of people who manage this whole program. They call the patients and they give them enough information. They inform me as and when necessary. They create notes, and overall, we try to keep our patients safe. And patients are also very happy saying that, yes, Dr. Baliga is keeping an eye on me. So that's an additional layer of security.
One of the presidents of Morehouse School of Medicine once said that all children should know their grandparents. I chose the name, as I said, this is my practice, and family first. You know, putting family first and then their health. So providing patients the health care that they need in a family fashion. My name is David Blake. I'm a family medicine physician. My practice is Family First Healthcare in Lithia Springs, Georgia. In family medicine, we're trying to practice preventive medicine, taking care of patients' disease processes and preventing them from having problems with those or even developing them in the first place. So my remote checkup helps to do just that by checking in on the patient in between visits. Typically, you see a patient once a year at minimum, and then depending upon their diseases, every 6 months or every 3 months. So there's always going to be a time frame when there's no direct contact between the physician and the patient, but you still need to know what's happening with their blood pressure readings and their blood sugar readings. And this is a way that they can be checked on remotely. And some of our older patients don't really have a lot of family members or friends calling them, talking with them. So now they develop that relationship because the navigator from my remote checkup calls that person consecutively. They don't go from one to another. It's always the same person. They develop a relationship and they get somebody calling them and looking in on them. The patients actually enjoy the app because, one, they can contact the office. No matter how many telephone lines, how many people you have working them, there's always going to be somebody that has to wait. So this is a way that the patients can contact the office after hours, even during the busy office hour days, and get their information to me as necessary. If there's a problem, it gets brought to my attention and I can adjust their medication, advise them to come in, or get them to where they may need to be. I have patients that are Spanish speaking. So now in the office, I do speak Spanish, but the rest of my staff does not. But we can get them a navigator who can speak to them in their native language, and they can more comfortably communicate their needs to the office. Some of my older patients, when they come back in for their first visit of the year, they have no knowledge of my remote checkup. So I get a chance to explain that to them. I let them know that that's now part of our practice. It's a means for me to keep up with them. And in years past, I had to give them pieces of paper to check their blood sugars on and write it down and write their blood pressures down.
I was just writing down everything, and sometimes I'll forget to have a pencil in my hand when I finish my blood pressure, or I'll forget what it was, or I used to take pictures of it with my phone, then my phone will lock out, so it's like, golly. But when I got the device, it made it easier, is because the results go straight to the doctor's office or to whoever's watching it, and it goes to the doctor. So, I'm very pleased with that. I'm glad that Dr. Blake chose my remote checkup. It has really saved me and my mind, so now I don't have to worry about writing down anything. You get just what you want, and I got just what I want.
My remote checkup is physician-run, so it's somebody who understands the process of the medical office and taking care of patients. And my billings personnel, they're supervising the daily records anyway through the EHR, so they're able to see if there's anything going on that should not be. And so far, there's been no conflicts, no errors, and everybody has been happy with the process. Unless you really want to commit dedicated staff members to enrolling the patient, asking the questions, and then documenting the billing procedure, I found it has worked better to go ahead and let the My Remote Checkup personnel handle that. They're skilled in it. They have been doing it prior to my knowledge of the program. They know the codes to use. They know which billers will and will not allow it to be used, and therefore they can go ahead and get the bills cleanly through and then turn around and do the reimbursement and reconciliations each month. And I have not thus far had any issues with that. And getting used to using the app myself, so far it has been fine. I have an opportunity to go into the app. I can find patients. I can see what their escalations are. I can see what their recent readings have been, and can communicate back with the patient directly from the app. That way it's not disclosing my personal information after hours, and they can still get the follow-up that they need in a timely fashion. Again, I'm Dr. David Blake, Medical Director of Family First Healthcare. I can be reached at 770-948-5400.
Namaskar, AAMI Parivar. I'm Santosh Karande. I welcome you all to the AAMI Parivar Global Talk Show. Today we are going to talk about excellence in diabetic management using new technology, continuous glucose monitoring, and remote patient monitoring with Health Well Safe. And our guests are Dr. Baliga, who is an endocrinologist from Alabama, Georgia, United States. And our another guest with us, Dr. Subodh Agrawal, who is a cardiologist from Athens, Georgia, United States.
Welcome. Tonight, we're going to talk about something new and focusing on diabetes. I'm Subodh Agrawal from Athens, Georgia. I am a practicing cardiologist in Athens for the last 25 years. I did my fellowship at AAMI and then intervention cardiology at UAB. I start thinking that who should control the cost of healthcare. So my interest is now has developed into creating a system where physician own system deliver high quality and low cost care. So I am chairman of the Doctors SEO and mainly focusing bringing independent physicians together so we can take care of our patient the way we would like to. So this is my pleasure to introduce Dr. Baliga. You know, you're really going to see a smiling endocrinologist. Dr. Baliga is he basically trained in India, England, did a MRCP in England, and then came to the United States. He did a fellowship at the University of Arkansas in endocrinologist, and then took him at the Mount Sinai Hospital, became a director of diabetic clinic, and then came to Columbus, and he has multiple practices in Columbus and Opelika in Alabama, LaGrange as well. I'm pleased to tell you that you can see him in Athens if you want to be his patient. So Dr. Baliga is very, very concerned about his patients. He's also very concerned about the quality of care as well as how well we control diabetes. So tonight we're going to talk for next 60 minutes about the new changes, new technology in managing diabetes mellitus, how a virtual care can provide a better control of diabetes. We will answer your question. Just please write the question in the chat box or in Q&A, and we will answer all your questions. We will also show you how Dr. Baliga using latest technology like remote patient monitoring and continuous glucose monitoring to maintain high quality care in diabetic patients. We also tell you if you do not live in Georgia or in Alabama where Dr. Baliga is licensed, you can still connect with him using our app. So all these things we're going to talk to you about tonight. So Dr. Baliga, I want to ask you this question. Tell me, diabetes is a common disease or rare disease, how common it is, and how many people being affected throughout the world?
Thank you very much, Dr. Agrawal. Sorry, I'm trying to, okay, here is the slide. So thank you for that nice introduction. I appreciate you putting together this great program. And I'm very happy that a lot of healthcare providers, they have logged in. And if you really look at it and you ask me, you asked me a very important question. So how many patients with the diabetes we have, right? So if you really look at it, you know, in the old days when we were in India, we used to think that diabetes is a problem of the developed nations, right? Western world. And but if you really look at it, when I was growing up way back in India in the 1970s, I could see a lot of my relatives with diabetes. My granddad had diabetes. My dad had diabetes. And unfortunately, he had a heart attack when he was just 45 years old. Then he dropped down dead at age 55. So those days we did not make connection between diabetes and cardiovascular disease. But that sort of shook me because I could see my mom, who was a very confident, very charming lady with all the confidence in the world. The day my dad died, she was a different woman. She lost all her confidence. So when we lose a patient, for us, it's just a patient, right? But for the family, it's something like a catastrophic event. And it's very difficult to recover. Even today, I'm sort of shaken up by my childhood experience when I saw my dad dying in front of me. So when I see my patients in my office and I keep on looking at them, I keep on talking to them, at the back of my mind, I keep on asking myself, how am I going to save this patient from having a heart attack or a stroke? How am I going to help this patient to live longer, right? So to understand diabetes, we need to look at the whole aspect. We now know that diabetes is a global disease, right? Look at the data. It's like mind-blowing, right? And each continent, when you see, look at the North America, including Caribbean. Over a period of next 20 to 25 years, the prevalence of diabetes is going to keep on going up to 33% increase. Look at the Southeast Asia, including India, 88 million people with diabetes now. And they're going to be 153 million in the next couple of decades, an increase of 74%. Look at Africa, poor nations, right? Still, they have a very high prevalence of diabetes. They spend enormous amount of money, billions of dollars. Especially if you look at the North America, 43% of global diabetes-related health expenditure occurs in the North America. So as you can see, we are in the midst of an epidemic, right? There's the diabetes and there's obesity. So we call it a diabesity epidemic. Now, the problem with that is as the number of patients with the diabetes keeps on going up, the number of endocrinologists that are available to treat this patient, they're not increasing. We are at a standstill. That's why wherever I go, people will say, Dr. Baliga, come and open a clinic here, right? And there is no way I can be everywhere. So that's where you come in. So Dr. Agrawal is a visionary. So when he walked into my office to look at my robot, I remember Dr. Agrawal, we had a Sandbot, the teaching robot. So that's the time we developed our friendship, and he's my guru when it came down to remote patient monitoring. He sort of showed me why we have to do the remote patient monitoring. Going back to India, in my medical school when I was growing up, we grew up in a place where there were not many resources, and those days treating diabetes was something different, right? So I used to call it a bullock cart age. Now we are in the Tesla age. I still remember being a resident in the Wenlock Medical Hospital. And if you ask me, how did you take care of diabetes patients? If I tell you, you laugh now. And especially my children, when I tell my son, Sujit and daughter Shivali, this is what we did, they keep on laughing because patients came to our clinic with a sample of urine. Remember, those days, no finger sticks, no hemoglobin A1C. You draw a blood sugar today, it comes back after a couple of days. So the way we treated patients is by talking to the patients, examining the patient, and examining the urine. So we'll take the urine to the side lab, and there's a Bunsen burner. We take the Benedict solution in a test tube. We put 8 drops of urine in the test tube, then we start boiling. And as you know, Benedict solution is a very bluish crystalline, bluish liquid. As the sugar level is high, it keeps on changing the color from blue to green, green to yellow, yellow to brown. Each time when the color changed, we said plus 100, plus 200, plus 300, plus 400. Then we looked for ketone rings. How beautiful, clinical medicine. And if you look at how did you assess the glycemic control, it was very simple. If a patient goes to bed at nighttime and never wakes up until in the morning without peeing, that's a good glycemic control. On the other hand, if they wake up 3-4 times in the middle of the night, then it is bad control. So it was so simple. So I've seen diabetes being practiced in India. Then I went to England. I worked in the Wales. I worked at the Royal Liverpool University Hospital. That's where I did my initial regional rotation in endocrinology. Then I came to America. I was in Little Rock, Arkansas. Then I went to Mount Sinai in New York. Then ultimately I'm here in Columbus, Georgia and Opelika, Alabama. And I'm in the right place. And because I see all these patients with the severe weight issues, diabetes, uncontrolled diabetes. And on an average, when patients come to see me, a typical patient will walk into my office with a blood sugar of upwards of 400, hemoglobin A1C of about 14, 15, sometimes unreadable. And they're so glucotoxic. And they have tried everything. They are on insulin, they are on GLP-1 analogs, they are on SGLT2 receptor blockers. And unfortunately, they're not doing too well. So my challenge is to educate these patients about the nature of diabetes, convince them that diabetes is a killer disease. Remember, cardiologists, Dr. Agrawal, you're a cardiologist, you'd always talk about widowmaker, right? But if you really ask me who is a widowmaker, it's the diabetes, because diabetes is a unforgiving disease. It ravages your body if you don't control it. No ifs, no buts. So the risk is heart attack and strokes. The risk is losing the eyesight, losing the kidneys, losing the feet. So what do we do with these patients? We've got a large number of patients, right? And about 10 to 15% of my patients, they're not under good control. So we need technology. That's what I've decided, because I'm down here in the trenches trying to take care of all these patients. And I need help, right? That's where you come in, Health Well Safe comes in, and I've got all these sensors and the pumps, and I do everything that's humanly possible so that I can take better care of the patients. So we talked about the endocrinologist shortage, right? So how do we do that? How do we manage this issue? So basically, we can develop a digital healthcare and train patients in remote patient monitoring. We can give them supplemental expert support. We can develop a virtual, scalable diabetic support system available on a daily basis, 24/7. And the whole plan is to create a patient-centric system in which the patient is in the middle of everything, and we are on the outskirts to help them. So we give them responsibility, we give them enough knowledge, we give them enough tools, and we monitor them closely. And how do we do that? That's why we need all these technological gadgets such as Health Well Safe, which is an amazing thing. I'm glad I'm doing it. But at the end, we want to measure the outcomes, share that data with the CMS and other insurance companies, develop a high quality and low cost care for all. But more importantly, we need to remove this disparity and inequality in diabetes care across the globe. So we started using Health Well Safe in our office, when Dr. Agrawal came and helped us. So now we have developed this nice program where the patient, enrolls into this program. And we have Dr. Ali. He's a doctor from Iran trying to get into residency program here. We're lucky to have him here. So he sort of manages all these initial, enrollment. So there's a patient app, smartphone, you develop and download Health Well Safe. And that will help that patient to upload all their data. And there's a care manager sitting in the call center. Call center is liaison between the patient and myself. Whenever there are issues and the issues get escalated to me, and when I get the message, then either I call the patient myself or one of my wonderful staff. We got amazing people work, helping me. We have nurse practitioner Rosa Nimi, or Kristen Osterreider, she's my PA in Opelika. I have my partner in crime, Dr. Malika Tirupati. See, we all take turns in calling the patients and taking care of the urgent needs. And we have other people in the office, like William and Keith, they are my MAs. And we have a front desk person, Misty, and Lori, my manager. It's like it takes a village to take care of your child, right? It's the same thing. It takes a village to take care of your diabetes patients. So one of the things what I realize is the old ways of testing your glucometer readings once or twice a day is not going to work for all the patients, especially somebody who is on an MDI regimen when they have a long-acting insulin at nighttime, short-acting insulin during the daytime. That, if they test only 2-3 times a day, then we can miss really serious hypoglycemic episodes and hyperglycemic episodes. So that's why we need this continuous glucose monitoring system. And we are fortunate, right? We have these amazing tools. We've got Freestyle Libre 2 sensor. We've got Dexcom G6. We've got Guardian Connect. And more importantly, Eversense, world's first implantable sensor coming back, right? And I was fortunate that I was the first in the country to use the 90-day Eversense about 3-4 years ago. And again, I was fortunate enough to use a 180-day. Now, remember, you put an implant in, you're fine for the next 6 months. And you see your numbers on the cell phone, how easy it is. So the idea is to look at the glycemic control. And the concept is there's something called time in range. Now that's the buzzword nowadays, because that's the most important thing. Because we understand that diabetics are not going to have a beautiful sugar all through the day and night. It's going to fluctuate. That's why ADA has laid some guidelines. So basically we look for a time in range. That means sugars between 70 at the lower end and 180 at the upper end. And that has to be about 70 to 75% of the time. And probably you're allowed up to 20 to 23% of the time above range. That's sort of acceptable. Time below range, which I always focus, we don't want more than 3 to 4% of the time. So if you can get your patients to in those time ranges, then patient will be much better. So here is a upper panel. You see before the patient was put on any kind of medications and the remote patient monitoring devices and the sensors, and then see how beautifully they come down from time in target of 55% to time in target of 88% after the intervention, after the sensor, and A1C from 10.2 to 6.9%, and the GMI. Now, GMI is a nice concept because when we talk about hemoglobin A1C, we talk about blood sugars overall control in the last 3 months, right? But what we really want to know, what's happening in the last couple of weeks. So that's where the glucose monitoring index, article GMI, comes in. It's a very useful concept, and it closely correlates with your hemoglobin A1C, although there are certain controversies, but I'm very happy when you look at the GMI. And so coming to the Health Well Safe app, on the left-hand side of the screen, you see the app. This is the patient's phone, right? And in the front page, they have all these things which they can click on. That there's a health data, and you click on, it will say what are the devices that are connected, appointments, alerts, demographics, documents, medication, and allergies. Then lower end, there's a care team with a phone icon. If you call, they will be connected to the call center where we have people who is going to manage the care managers. They sort of triage the patients and then decide whether to escalate to Dr. Baliga or some other physician who is in charge. So this is one of the way we manage our patients. We try to talk to the patients or send even text messages. Here, I recommend after reviewing the chart, realize that the patient was getting too much nighttime insulin. I recommended that from 20 units, let's cut it down to 15 units. So patient gets that message, then patient's responsibility to text back to us saying that, yes, I got the message, and they adopt the change. So this is handsome me and on a video call. Thank you, Dr. Agrawal. So let's move to the dashboard. Now, dashboard is one of the best things, Dr. Agrawal, you created, because when I open my dashboard for Health Well Safe, I have all these patients. Remember, we are talking about the population health management. This is how it should be. So this is one of the nicest dashboards I've seen, almost as good, probably, pretty good. When I, one of the other dashboard that I like most was the Bigfoot Unity device dashboard that we'll talk about it a little bit later. So when I open my dashboard, I look at alerts, red triangles, right? And here I'm being alerted that patient number 1 is having some issues. So then we try to click on that and find out what's happening. Now, this is the patient. This is my first patient I'm going to talk to you about. This is a very nice gentleman. My patient has been for some time. He's very close to me. He comes to me all the time. Sugars are reasonably well. He's not the best of the best patient. Then he disappears for about like 3 to 4 months. Then he comes, and I was flabbergasted because his blood sugar was 265. And when we did the finger stick hemoglobin A1C, it was 11.4%. And I was like, what happened? Obviously, this is unlike of him. Then I had a chat with him, then realized he's a nice guy. He wanted to help one of his friends. He moved to some remote area and helping them to run a motel and neglected his health. So he was on metformin 1,000 milligrams twice a day. See, what bothered me most was he had underlying coronary artery disease. Remember, we talked about it. People with coronary artery disease, their lifespan comes down very drastically if they have underlying diabetes, coronary artery disease. On top of that, if they develop a stroke, then the lifespan comes down by about 12 to 19 years. That's why we have to be very careful in patients like this one so that we can keep them safe. So I restarted all his medications. We gave him a sample of Ozempic because he had run out of it. We put him back on Humalog, put on Tresiba, and we had Freestyle Libre to sensor sample. I talk to Shelly all the time nicely so that she can give me more samples. It's trouble although, but it's okay. She gives me samples. So now, look, this is what we did. We changed the therapy, put the Freestyle Libre, and we enrolled him in remote patient monitoring. We watched him closely. Now, this is what happened. After he came back after like 8 or 9 days, we downloaded the Libre, and I was so surprised. In his entire life, he wasn't as good because that day I shouted at him, it worked. Plus the very fact that, when you put a Libre sensor or any continuous glucose monitoring system and you tell the patient that I'm going to watch it remotely, then they behave better. They're just like children, right? Children do the same thing. As long as we keep an eye on them, they do good. You take their eyes off, they go back to their monkey business, right? So the same thing with my patients. My patients are like my children. I want them to be safe. So this gentleman, I was so thankful that he listened to every word that I spoke to him. Look at his time in range, almost 100%. So this is within like 8 to 9 days. This is where the value of educating the patient, giving them the necessary tools, using the remote patient monitoring. And to tell you frankly, I didn't do much for this patient, but he improved tremendously. So that's what we see, even when we had a poster presentation at the ADA recently with the Bigfoot Unity device. And in that one, we showed that as about 49 patients when they were put on Bigfoot Unity device, especially those who started at an A1C of 9.5%, their GMI came down by about 2% within 2 weeks. See, that's the thing I'm talking about. We need our patients, they need more help. It's not only enough to start a patient on insulin therapy and send them home. The old way of managing patients where you see a patient once in 3-4 months never worked, it's never going to work again. So things are changing drastically. So this is how we changed his medications, and he did very good, and I'm very happy. So then we move to the next patient. Now, this is another very, very interesting patient. So Dr. Agrawal played a very big role in this one. This happened to be a patient from India. He's actually a practicing physician, very smart guy, hard worker, unfortunately had very bad diabetes. And he was in New York, and one day Dr. Agrawal calls me, and his blood sugar was more than 400. And I think he was on metformin at that time, glimepiride and Jardiance, and probably used Trulicity or something, but he did not bring his pens with him. And we started talking to him, made some changes to his eating habits, made some simple changes. Then Dr. Agarwal actually flew over to New York with the Dexcom in his bag and Tresiba and Ribelsus. He went and stayed with him, and we talked every day. We used the Health Well Safe app. We did video calls, and even before Dr. Agarwal reached, he had already showed signs of improvement. His sugars were coming down, and from July 17 to July 31st, these 2 weeks, his blood sugars were averaging 171. And if you look at the GMI 7.4%, look at the standard deviation 38, 62% of the blood sugars within range, 35% high, 2% very high. There were not many lows. That's very good. I like that. I don't want low blood sugars. I'm okay with a little bit of high blood sugar. So this is what we did. We added Tresiba, 20 units at nighttime. We told him to take Humalog 10 units with each meal. We started him on Ribelsus, started with 3 milligram, then gradually escalated the dose, continued with Jardiance and metformin. And look at it. So a couple of weeks later, we downloaded his meter, actually August 24th, a couple of days ago, yesterday. So now you see his average blood sugar is 134, GMI 6.5%, and 97% of the blood sugars are within target range without too many hypoglycemic episodes. And I watched his numbers on my iPhone through their Dexcom app called Dexcom Follow. The only time I could not look at his numbers was he was flying from New York to Mumbai. So every day I look at his number. In fact, you can see, I'm watching now. He's running 165. And if you look at the arrow, it's a straight arrow. So that means his blood sugar is very stable. So this is one of the best case scenario where, you can take care of the patient in a very remote area. India is like thousands of miles away, time difference, but it doesn't matter, right? All we need is a willing patient, and we have good medications. We have got amazing remote patient monitoring devices and the continuous glucose sensors. Look at it, this gentleman, a productive member of the society, a great physician in India, and he would have had some bad outcomes if not for Dr. Agarwal, flying to New York, albeit to Hamptons to have some fun also. But he did very good. And the best thing is, patient followed everything that we told him. That's the most important thing. That's what I tell my patients. Listen to me, we'll take you to places. Right. So this is how we managed 97% of the time in range. Yesterday, he was running about 97, and you see how numbers were running so beautifully. So this is the third patient I'm going to talk about. Now, this is very interesting. So a couple of weeks ago, I was finishing up my work. I was done. I was waiting for my beautiful wife, Pratibha, to finish her work. It was around 8:30 in the evening. Then one of my close friends, he's a doctor friend of mine, he calls me. He says, Suresh, I want you to see this patient today. And I said, what's happening? So this gentleman, he had some illness, and he was never ever diabetic, but he was feeling bad. So my friend took a glucometer to his home and tested his finger stick. And lo and behold, it was 590 or something. They were like so shocked. Now, what do you do for this patient, right? He says, yes, I talked to him on the phone. He said, yeah, I've been feeling bad for the past 2-3 days, waking up in the middle of the night, passing urine 3-4 times a day. and his food intake wasn't great. That's why he was eating some mangoes and drinking mango juices, because he could not eat too much of solid food. So that probably tipped him over to become diabetic. Anyway, so what do you do for this patient? In the old days, we said, okay, just go to the ER. Evening 8:30, why you want to take a chance? But I knew this gentleman very well. I said, okay, we need to help him. I said, okay, bring him over right away to my practice. So it was raining cats and dogs outside, and they come to my office. And obviously, his sugars were still high. So what we did was we started him on Tracy about 10 units. I gave him a shot in my office. I showed him how to inject Humalog 8 units with each meal. And we put a Libre sensor on him. And it was a very difficult that day because they were really, really worried, because to have a diagnosis of diabetes out of nowhere, despite all the problems they were having. Okay, not only that, on top of that, now I'm telling, oh, you have to go on insulin shots. Then I'm saying you have to test your sugar 3 to 4 times a day. Then I'm saying, you have to watch your sugar very closely. And they were very worried. What if my blood sugar goes very low overnight, right? That's the biggest worry when you start patients on insulin therapy. So I helped him in the sense, we said, okay, we'll put you on this remote patient monitoring so that we can closely watch you. And every day he will text me. I will look at his numbers. Then I will give him suggestions. So I told him, call me whenever in trouble. Especially, I want to know before you eat your meal so that I can tell you how much insulin to give. Then I want you to call me before you go to bed at nighttime. Then I can tell you how much Tresiba to be given. So we kept on exchanging the text, the messages, and you could see his sugars coming down from the 400 and 600s to mid 100. Obviously, he was still a brittle diabetic. Turns out he was a type 1 diabetic. So because of some medication that he took in the past. But overall, this is where I see myself, because we have to change the paradigm of taking care of our diabetic patients. And it takes a village to raise a child. It's the same thing. It takes a village to take care of diabetic patient. That's why we need Dr. Agrawal's Health Well Safe app. I need my diabetes educators. I need my office staff. Then more importantly, I need all these gadgets that we have. We were so fortunate that we have these things available at our fingertips, okay? And the Big 1480 device, I've been using it a lot. And for those of you who are not aware of it, it's basically you use the same insulin pens, but you take the cap off, the company will give you electronic smart caps. So white pen cap works like a reader. So when you bring it close to the Libre, it shows you the number. Then you press a button, it will tell you how much insulin to give. Plus, we see all the data on our desktop in their clinic hub. That works beautifully. I use it for sort of like a population health management, and I'm going big time with that now, and all my patients are very happy. Then coming to the sensors, we use a lot of Libres. Whenever I run out of the Libres, I call Shelly. Then we use a lot of Dexcoms, and Paul is an amazing, wonderful guy. He comes and helps me here. He comes and helps me in Athens in Dr. Agrawal's office. Then look at the Eversense in the middle. Now, I'm so fortunate that I was the first in the country when Eversense came about 4 years ago. So we inserted 3 Eversenses in Columbus office that day. Then we were fortunate enough then when it came back again in a 180-day version, that's 6 months. Again, I was the first one to try it in Alabama. Now, it's beautiful, right? You put the sensor underneath the skin and it stays there for about 180 days. Then you have that black thing, that's the transmitter that beams the blood sugar to your handheld smartphone. Then it has on-body vibration if the blood sugar goes up and down. Amazing, amazing device. Then we have got all these pumps, sensor augmented pumps, the Medtronics, the Omnipod 5, and T-Slim X2. Beautiful devices. They talk to their own sensors. Of course, Medtronic has their own sensor. Omnipod 5 and T-Slim X2, they use Dexcom G6 for input, glucose input. Now, this is a very interesting device. It's called a Pogo automatic. This is the first automatic blood glucose meter. So you don't have to have separate lancet devices. But you see that blue hole, you keep your finger there and it will do a finger stick and you get the report within 4 seconds. And not only that, it will give you nice reports. There's something called patterns. There's some diabetes education material in that. Patient can look at blood sugars in the last 24 hours, last 7 days, then they can create a report and send it to us. And we have started using it for remote patient monitoring also. This is something which has a great future according to me. But more importantly, Dr. Agrawal, being the visionary he has this grand idea. What he wants to do is put everything in one place. Instead of jumping into different platform and wasting time, what if we connect everything in this health well safe device? Okay, so we are already almost on the verge of integrating Dexcoms, and we are working with the Freestyle Libre 2, we're working with Eversense, and we'll see whether we can persuade Bigfoot Unity people also to be partners. Kathy Lee is helping us to integrate a Pogo into the health well safe. As you can see, sky's the limit. I'm so glad that we have moved on from bullock cart age to the age of Tesla. Okay, this is all different and exciting times. So Dr. Agrawal, I talked too much, right? So now it's the time for you to budge in and say how, we can't hear you. Can you unmute yourself?
Georgia and
yes.
Alabama. So the question is how an established patient of Dr. Baliga can get remote patient monitoring started. Very simple. Basically, he just have to give a consent, and then we can deliver device, educate the patient how to download the remote patient monitoring, and we'll give them credentials. And basically, the minute he connect his data, Dr. Baliga was able to see, we will be able to see that. And if we have glucometer, you can enter the data from glucometer. If we have continuous glucose meter, then it's automatically, right now it's Dexcom 6, but slowly, hopefully, as Dr. Baliga said, we'll have other devices comes in. So basically, he will be part of those 10,000 patients of Dr. Baliga he will monitor every day using our dashboard, and only going to see the patients on the dashboard who are sick. So basically, all this data are together in a HIPAA compliant capability, and all is encrypted. The data is encrypted from our app to the server, and then server to the app. So the conversation cannot be leaked between patient and the physician as well as the care manager. So we made sure it following the rules and totally secure. So it's very easy if you are in Alabama, you are Georgia, and if you want to have Dr. Baliga as a endocrinologist taking care of diabetes, he can handle it. Basically, with our help, Health Well Safe help, I think we can increase his capability. We can clone him in different places, and he can treat patients from Savannah as well as from Montgomery. So now the second question is, we can go one slide back. Second question is that if you're not in Alabama or not in Georgia, or you are in Turkey, and he just showed how he took care of a patient from India. So if you're not in those two states, he can still help you. What you need to do is download the app and put the data in there, and he can look at the data and you can talk to him too, but he will not be your patient. So the patient and physician relationship will not be established. So you have to have your own physician, own endocrinologist locally. You can take his advice to him, and then he or she will prescribe the medication to them. So you can still have a high quality advanced diabetic care from Dr. Baliga, but as a more like a friend, a consultant, not your personal physician. Now, we want to make sure things will happen like that. There is so much diabetes and so few endocrinologists. We got to use technology to solve the problem. So next question is how much it costs. So if you are lucky, you're lucky if you're in Georgia and Alabama, Dr. Baliga can provide the remote patient monitoring and telemedicine as well as continuous glucose monitor in Alabama at no cost to you. Only the cost of remote patient monitoring and telemedicine, which is usually get paid by the insurance, and patient may be part maybe like if you pay 20% to Medicare, that will be, if you have supplement, you probably have to pay nothing. So the app will come free to you, but you have to pay for patient monitoring, remote patient monitoring, as well as telemedicine. Now, if you're not live in Georgia or Alabama, and then you can use the app, and Dr. Baliga as backside, he would advise the care manager what to do. So the app plus service will cost you $20 per month, which first month is totally free. You got to be totally satisfied that it's useful to you. Now, if you want to see Dr. Baliga and you are in Turkey or India or out of these two states, you still can see Dr. Baliga and he can talk to you. You just have to pay his fee. Is like minimum fee of $250 for first 30 minutes. Basically, we do not put you on a contract. You can discontinue anytime you want. We believe that once you get in to know Dr. Baliga, he don't go anywhere. So that's why there's no contract. Next slide.
Thank you.
So that's the question. We want to make sure that what is remote patient monitoring? You're monitoring a patient and patient got hypoglycemic. Am I responsible for that? The answer is no. So remote patient monitoring is a non-emergent service. Non-emergent service. If it's emergency, you need to take control and you call 911. So the physician using remote patient monitoring is not responsible for everything 7/24 hours. If anything changes, he will know about it and he will respond between 3 to 5 days. That's totally fine because you're doing remote patient monitoring. Usually it doesn't happen because we're monitoring the data and we will escalate that to Dr. Physicians, and usually that taken care of within 2 to 3 days. So some physicians say, listen, I don't want to be responsible for a patient getting sick while I'm sleeping. Yes, you're not responsible, but just imagine, at least you will know what happened to this patient, and then you will be able to take care of them next day or day after, something like that. So it is very important to know that, but just imagine the advantage of remote patient monitoring, how close you become closer to your patient and how better care you can provide. And you know, there is evidence, and Medicare know that, payer know that. By providing remote patient monitoring, you improve the quality of care as well as decrease the cost. There is data out there, and you're welcome to study that. You can call Dr. Baliga or call me, and or we can send you the published data.
That's very good, Subodh, because you know, the way we have to change our mindset, instead of providing a reactive care to the patient, we need to be really, really proactive. So the whole idea is to prevent patients from developing severe hypoglycemia and prevent them from going to the emergency room in the hospital. And that will translate into, you know, saved healthcare dollars. Plus for the patients, you know, having a hypoglycemic episode is really a big event in their life, because if you develop a severe hypoglycemia, you could be driving and you may not even realize, especially if you have a hypoglycemia unawareness. We have had so many patients having accidents and you know, dying in their sleep because of the hypoglycemia unawareness. And hopefully, you know, using all these strategies, using the continuous glucose monitoring systems and remote patient monitoring and adjusting their medications frequently instead of waiting every 3 to 4 months. Hopefully, this is going to be the new paradigm of providing excellent care to the patient population and save money for the healthcare system, save lives, and at the same time, and for doctors also, it's an additional source of income. In the old days, when we called our patients on the phone, it was a free service because insurance companies did not pay us. But if you use these chronic care management, remote patient monitoring codes, then each minute when you talk to the patient, it's a billable minute. So that means you add some extra money to the office revenue. Remember, most of the doctor's offices, we don't make a whole lot of money, right? We just get by. So now, you provide an excellent care at a low cost, and you keep the patient safe, you save money, plus you make some money for yourself. The best model ever.
So, Dr. Baliga, there's a few questions, and I can take few questions, and you can take some questions. The first question, I think I'm going to give it to you. So this is a question from anonymous attendee, doesn't want to declare himself, but he's saying, listen, I'm very diligent in my management of diabetes. I want to live, but I go meaning I need cheat days after being on point for so long. That worked for me. And sometime around my grands, I totally fall off the wagon, as they say, for alcoholic, and my sugar goes up to 300. If I look back, this happened at least once a year. Any advice for me? Please share my question. Feeling alone in the fight of diabetes. What do you think about that?
Yeah, that's a very important question, because a lot of patients are like you, because they're worried about their glycemic control. They're so busy running their life, and they don't have too much time to take care of diabetes. But I always tell them, take a breath, smell the flowers, and sit back and evaluate your position. Look at your sugars and look at your glycemic control, and seek for help. Use remote monitoring devices, especially if you are too busy, then use one of these continuous glucose monitoring system, so that if you use a Libre or a Dexcom or a Eversense, you can get a warning even before the blood sugars go too high or too low. So there is help available, but you have to find a good physician who can help you with all these things. You need to know your numbers. Make sure that your fasting sugars are between 80 to 120. 2 hours after eating, not more than 180. And watch out for hypoglycemia. It looks like you're more worried about hyperglycemia of 300, but I will take a high blood sugar anytime rather than low blood sugars. And remember, you don't want too low blood sugar. There are 2 levels of hypoglycemia. One is level 1, below 70 milligrams. Level 2 is below 54. So yes, don't worry about a couple of high readings, but try to get your blood sugars in that range. We talked about time in range, about like 70 to 75% of the time. Make sure that you don't get more than 3 to 4% of hypoglycemic episodes, then never more than 25% of 23% of high blood sugars. But I think there is help available. You have to change the way you manage your diabetes, and we'll be glad to help you.
I'll take the next question. Question is from Soheb. Are you able to share patient data with primary care doctor if that PCP is not using Health Well Safe app? So this whole program is basically making patient-centric system. So patient have all the data. Everything we do for patient, the care plan, everything patient has it. And if patient want to share with anybody he just have to press a button, and it can go to as a CCDA, it can go to as a PDF. We don't recommend PDF until it's a direct email, but it's in the patient hand. So answer to your question is yes, patient can share the data with the primary care physician or with the endocrinologist. We will share the data with anybody if patient want to, but we will share. The patient has to give that permission to us before we share data from them. So basically, our goal is to make the patient responsible for his illness and help him, give all the knowledge, all the tools, everything, and give him the best care at the lowest cost.
Yes, we really like primary care doctors to interact with these patients. because after all, I'm just an endocrinologist, but they need to have the backing of their primary care providers because they take care of most of this stuff. And yes, we always like to send our reports to primary care providers if they want it, but at least our office note goes to them on a regular basis.
So next question is, are you going to incorporate the continuous glucose monitoring reading into the program? Answer is definitely yes. We have iGlucose already integrated. Now the Dexcom 6 is almost ready to go. Maybe by next week we will have a active program. All patients of Dr. Baliga who has Dexcom 6 will be on that dashboard we showed you about, and the other will follow.
And where are we with the Pogo integration, Subodh?
Yeah, Pogo, we're talking to Pogo. Pogo is interested, and as soon as they're ready, we are ready.
Okay, good.
So Dr. Baliga, I really appreciate your kindness, your time, and your feeling to help me. I am really thrilled the way you take care of my nephew. I mean, this is awesome. The way you keep his glucose on your phone, it's awesome. So thank you very much. Thank you, audience. Thank you, everybody, to listen to us. We are here, and on the website, we have the QR code, and that tells you how to get in touch with Dr. Baliga and Health Well Safe. And we have a website, www.healthwellsafe.com. You go there and send us message what you want, and we can get back to you and get it done. Thank you all. We will continue to come and give more classes like that. We will discuss more continuous glucose monitoring. We will really want to promote remote patient monitoring. If you're a physician, please think about that. If you're a patient, please think about it. This is the technology is the way to go to improve the care as well as decrease the cost. Thank you all.
Okay.
Dr. Baliga, last word from you?
Yes. Somebody sent a text here on the chat. They said something about what other GLP-1 analogs you recommend. So we use a lot of GLP-1 analogs in our office. We use a lot of Ozempic, and now we have Rybelsus. Trulicity works very well. Bidorion, it's sort of falling out of the picture because it doesn't have any cardiovascular data. But now the newest something called Mounjaro, which is a GLP-1 analog with the GIP. So we just started using it. So my idea is to use whatever we can for our patients. We look at the efficacy, we look at the side effect profile, we look at the ability to lose weight, and we look at the cardiovascular protection. And then more importantly, look at the insurance coverage. As long as the insurance coverage is good, I don't mind using any of the medications. But the focus is, controlling the diabetes in a reasonable fashion, protecting their heart, protecting their kidneys, helping them to lose weight, because GLP-1 analogs are one of the best class of medications that we have. Fortunately, we have got all good options. Thank you.
So is there anything we have not answered? So I think you can see the chat, Dr. Baliga. Do you see anything which we need to address?
Yeah, so that somebody asked about Carendia. Yes, so that's one of the new interventions that we have been using in patients with type 2 diabetes with the chronic kidney disease stage 3, especially if they are on an SGLT2 receptor blockers. Then we have started using Carendia. It's pretty good. It will protect the kidneys. There is some cardiovascular safety
What is
data
Carendia?
also. So that's why, as I look at it, as I said, it takes a village. I'm so happy, you got all these amazing agents, and sky's the limit. We love our patients to try everything so that they live longer. Thank you.
Very good. I want to take the last few minutes to congratulate our team, and we have Chasco. Chasco, can you show up a picture? And Judah, he's in Texas, helping us from there using remote patient monitoring. Thank you, Dr. Baliga. It's been great, and we will continue to do that more and more often. We will really want to improve the ability of Dr. Baliga to patient, especially complicated patient with diabetes, requiring insulin and having problem managing it, you will see the effect of remote patient monitoring and your therapy. Thank you all.
Thank you. Have a great evening. Thank you, Dr. Agrawal.
Thank you. Thank you.